Butis Media Academy esangibwa masanafu okuliranira Pechip Hardware ejjukiza abazadde mwenna okuwandiika abayizi abaagala okubanguka amasomo gano wammanga kwatandise radio and television presentation, graphic designing, VMX and transmitter controlling, okukyusa ebifaananyi okuva mu studio okudda ku TV, audio and video editing, news anchoring, filming and photography, computer training n'ebirala. Okwewandiisa ku ttendekero lyabwe gendayo nga bukyali Butis Media Academy banjawulo ku matendekero amalala kubanga basomesa practical skills oba hand zone mu masomo gaabwe gonna. Essimu 0753 242 wa 0753 242 awulidde ng'otegeeza omulala. Butis Media Academy esangibwa masanafu okuliranira Pechip Hardware ejjukiza abazadde mwenna okuwandiika abayizi abaagala okubanguka amasomo gano wammanga kwatandise radio and television presentation, graphic designing, VMX and transmitter controlling, okukyusa ebifaananyi okuva mu studio okudda ku TV, audio and video editing, news anchoring, filming and photography, computer training n'ebirala. Okwewandiisa ku ttendekero lyabwe gendayo nga bukyali Butis Media Academy banjawulo ku matendekero amalala kubanga basomesa practical skills oba hand zone mu masomo gaabwe gonna. Essimu 0753 242 wa 0753 242 awulidde ng'otegeeza omulala. Butis Media Academy esangibwa masanafu okuliranira Pechip Hardware ejjukiza abazadde mwenna okuwandiika abayizi abaagala okubanguka amasomo gano wammanga kwatandise radio and television presentation, graphic designing, VMX and transmitter controlling, okukyusa ebifaananyi okuva mu studio okudda ku TV, audio and video editing, news anchoring, filming and photography, computer training n'ebirala. Okwewandiisa ku ttendekero lyabwe gendayo nga bukyali Butis Media Academy banjawulo ku matendekero amalala kubanga basomesa practical skills oba hand zone mu masomo gaabwe gonna. Essimu 0753 242 wa 0753 242 awulidde ng'otegeeza omulala. Butis Media Academy esangibwa masanafu okuliranira Pechip Hardware ejjukiza abazadde mwenna okuwandiika abayizi abaagala okubanguka amasomo gano wammanga kwatandise radio and television presentation, graphic designing, VMX and transmitter controlling, okukyusa ebifaananyi okuva mu studio okudda ku TV, audio and video editing, news anchoring, filming and photography, computer training n'ebirala. Okwewandiisa ku ttendekero lyabwe gendayo nga bukyali Butis Media Academy banjawulo ku matendekero amalala kubanga basomesa practical skills oba hand zone mu masomo gaabwe gonna. Essimu 0753 242 wa 0753 242 awulidde ng'otegeeza omulala. Butis Media Academy esangibwa masanafu okuliranira Pechip Hardware ejjukiza abazadde mwenna okuwandiika abayizi abaagala okubanguka amasomo gano wammanga kwatandise radio and television presentation, graphic designing, VMX and transmitter controlling, okukyusa ebifaananyi okuva mu studio okudda ku TV, audio and video editing, news anchoring, filming and photography, computer training n'ebirala. Okwewandiisa ku ttendekero lyabwe gendayo nga bukyali Butis Media Academy banjawulo ku matendekero amalala kubanga basomesa practical skills oba hand zone mu masomo gaabwe gonna. Essimu 0753 242 wa 0753 242 awulidde ng'otegeeza omulala. Butis Media Academy esangibwa masanafu okuliranira Pechip Hardware ejjukiza abazadde mwenna okuwandiika abayizi abaagala okubanguka.
We are back again with our show, Health Clinic, Matters of Health. That is what we all discuss about Health Clinic here. Exactly on Friday, exactly 11 a.m. in our studios. And we are joined in with any expert to help us to tell us some of the diseases you're suffering, how can you avoid them, especially when you're even in this time of COVID. Some of these doctors will tell you how can you avoid the COVID, what can you do. Yeah, you have been told some of the conclusion, but still you have even the health experts, what they have to say about it. Yeah, I believe today we're going to open up with some briefing about that, because we all know that is the life you're living in now and you cannot avoid it. But how are you? Your Health Clinic is brought to you by the Fundamental Rights and Protection, who say rights matter and they're there to protect them for you. Don't forget to share the link. Go on our Facebook page and YouTube. You just type in Youth Media. Instagram, you're there. On Twitter, you're there. All you have to do is just type in Youth Media. You find us there. We have a lot of things. We have lots of programs, and even up now we have a new introduction of Youth Academy, where we are teaching and educating the students out there, especially when you know that our president opened up the economy for the students to go back to school. What is your child doing at home? Just bring him here or her at its media academy. We shall definitely teach him, and not only teaching him the theoretical part, but what we call the hands-on practical work, where you say you just sit, we present, and he presents. Not just you're supposed to do this. No, we do it practically. Hold the camera firmly, and your hands are on top. And back again with our doctor. I'm your host of show, Brenda, bringing you Health Clinic, and our doctor. We welcome you on our show.
Thank you, Brenda, for your invitation.
Okay.
Yesterday we did sickle cell.
Yeah.
Also, they are going to do sickle cell, but in English.
In English.
Sickle cell, it's a disease which we get from our parents. We inherit this disease, and nowadays it is very common. Based on research which was done in 1970s, 20% of the Ugandan were all sicklers. And I don't know up to the numbers now, but if in 1970s they were 20%, now I think we are more than that.
20%.
20%.
Now we are more.
We are more than that.
Okay.
And currently, 33,000 babies who are born in Uganda have a defect within their hemoglobin.
A defect of sickle cell.
Yes.
Okay. So that is how sickle cell, and if somebody is to define it, how do you define it, sickle cell?
Like it is an inheritable blood disorder causing someone whose red blood cells to have an abnormal shape, that is a sickle shape.
To have an abnormal shape, which
Yes.
is a sickle cell.
Yes.
I think they will display that picture of what
Yes,
you're
yes.
describing. So why? Because yesterday, look, you're telling us it has a shape which is
It's the crescent shaped.
okay, crescent.
Yes.
Kind of oval, I would say. Is it oval? Not oval, but like the moon-like.
Yes.
I'll say the
Yeah,
moon-like
moon-like,
shape. Yeah,
moon-like
the
shape.
moon-like shape, different from the usual one. So how it's supposed to be. Our doctor was yesterday telling us, but now even he's back again. Yeah, for those who are just joining us, the topic is sickle cell. What are the symptoms of this sickle cell? How can you identify the sickle cell symptoms, and how can you even avoid it before even you have a child or you become the victim of sickle cell? Our doctor is back in the studio to tell us what are some of those things we can do to avoid sickle cell. What, in case you are suffering from it, how can you go along in the process? How can the health experts treat you? And yeah, it's Dr. Malay in studio with us. So
Yes.
doctor, on that point you can continue. You are telling us, you're also going to tell us how somebody gets this sickle cell as a disease.
We have so many scenarios. If maybe our producer help us to display as I'm continue explaining. If both parents are carriers,
Okay.
one mother and father are both carriers. A carrier, I mean, carriers are not sicklers.
Carriers are not sickle.
Yes, carriers, they just have a defect within their hemoglobin, but they don't have symptoms. Yes, actually, with a carrier, they have inherited one copy of a gene, that is the hemoglobin S.
They have only inherited one gene.
Copy. To be a sickler, you need to get two copies from both parents. But with the carrier, they just get only one copy from either parent. So they have only one copy of the gene, that is hemoglobin S.
Okay.
For them, they don't have symptoms. They look like normal. They live normal life. They do activities which other people do. But whereas for the sicklers, they inherit two copies.
They inherit two copies.
Yes. That I'm explaining that scenario that when two carriers meet and they produce children, they get sicklers.
They get sicklers.
Yes, they get sicklers. Chances are 25% you have a sickler. 50% you have you produce carriers, and 25% you have a normal child.
You have a normal child.
Yes.
Well, that is the percentage we are
That's the
looking at.
percent. That's scenario one. That's like the risk.
Okay.
Scenario two is when two sicklers, a father and mother, then meet and then they try to have children. When two sicklers meet, all the children will be having sickle cell.
when two sicklers meet,
Yes.
oh, definitely, it's an automatic. The child they're going to have is
You won't have a normal child, a normal hemoglobin. Yes.
there would not be any chance at all.
Yes.
Well, hope they're hearing. Okay.
Another scenario is if a sickler meets a carrier. Still you produce children who are sicklers and children who are who are carriers. So I think it is better for us before we plan to have children to first go for sickle cell screening, because you never know, you never know that maybe you're a carrier, because carriers don't have symptoms.
Carriers, they
Yes.
don't show any symptom at
Yes,
all.
they don't show any symptom at all.
So you just have you just be like a transporter of that sickle
Yes,
cell.
because yesterday we said that it keeps on moving among generation.
Okay.
If your grandfather had it, then your father is also a carrier, then also even the children which you produce will still be carriers. So it keeps on moving among generations.
It just keeps on coming again and again.
Yes, yes.
Okay. So those are the scenarios we look at.
Yes, yeah, those are the scenarios. So if a sickle cell patient meets someone who is normal, who is not a carrier, and has having normal hemoglobin, they'll produce carriers. They won't produce any sickle cell.
They won't produce any sickle cell.
Yes, so it's better for the sicklers to marry normal people with a normal hemoglobin.
With a normal hemoglobin.
Yes.
So it's not like any other disease that, like, maybe it's transported through sexual activities.
It is not transported through sexual activity. It is
Because
just-
now somebody will worry, hey, I don't have sickle cell, how can I go with somebody who is a sickler?
Because with sickle cell, it is there is a mistake. Actually, we call it there is a mutation.
Okay.
Mutation, I mean, there is a mistake when our DNA is being produced. So that thing keeps on moving among generations. That mistake does not stop from there. If the mistake happened in your grandfather, mean even your father will have it. Even you, the child, will have it. Even the children which you produce will still carry that mistake. So it's that mutation. We don't want to go into the details because our people won't understand. That now we will say, ask now, doctor. I talked about mutations, confusing us. So just know that with the sickle cell, that the mistake happened long time back.
The mistake happened long time
Long
ago.
time back, yes. Like when in our DNA, there's a gene which we call which is responsible for production of hemoglobin. So when that gene, when there is a problem with it, when we produce that or production of that globin protein, that mistake happens and it keeps on moving among generations.
Okay.
Yes.
So the mistake continues. That's why you call upon couples before they go into
Yes,
even having a kid. They
yes.
first come. Just like how we go for HIV testing, that means also there should be like one of the criteria.
But it's really very important.
It's important.
It's among the one of the diseases which should be screened before people start to maybe plan to be together.
But do you receive them to? Do they
Majority come. Those who are sensitized, who have knowledge about it, they come. Some don't come. They just wait and see what God brings. Yes, but it is common now.
It is common.
If you got the sickle cell ward, it is full.
It is full.
Yes.
Because now that means if they come and you identify that one of them is a carrier of sickle cell, if
Yes.
both of them are carriers, then you advise them to split.
To
or
split, yes.
But now splitting, is it easy for them to split?
It is not easy, but for medical reasons, after counseling, we can tell you maybe there's nothing you can do. Because chances are 25% you probably have a normal baby, 25% you have a sickler. You will never know what you're going to produce.
So it's just either way.
Yes. I'm not saying that it is compulsory that you are going to produce a sickler, but the chance of you producing a sickler is 24%.
And I believe you talk from a point of experience and you have
Yes.
seen and tested it and proven.
Yes.
Anyway, that is good to know, because it's earlier. The earlier you know it, the better. And if you touch where the cause or the root cause of sickle cell, where it comes from, if you can foresee that in case I go on with this relationship, in case I go on with this person, you can produce a sickle. It's not like any other disease that you can, as our doctor said, it's not like any other disease that you get through maybe sexual intercourse. No, this is in the genes of the body. Maybe your ancestors had it and you are a carrier, and you can carry it on to the child. So before you go into any relationship or you go into having any child, first go for testing, just like you go for HIV testing. Also, there should be a criteria. So our doctor, as you're talking about sickle cell, what are some of the symptoms you look at when it comes to sickle cell?
People are watching that picture which the producer has projected. You are seeing one half, the blue half, and then the black one. So it means you are having a problem, and then you are having 2 copies of a gene from your father and one from your mother. You can see those 2 parents. They have their children. That one who is in the blue is a sickler. Okay. This one who having 2 still, they look like their parents, meaning they are carriers. This one who is black maybe is normal.
Okay.
Yes. Yeah.
So those are the chances we look at.
Yes.
Wow, that is a graph. It's eye-catching to look at. But now, as our viewers are seeing it, so hopefully you know how you can get sickle cell. You don't have to learn it to the maze. I call it the maze, and they're like, because you yesterday narrated a story where a child came in and said you were asking the parents why they gave birth to her through that child.
Yeah,
because of the pain.
It's really painful, and those children suffer a lot because they need all of their lifetime. They spend a lot of time in hospitals. And they're having complications, they are in extreme pains. So those kids will blame you. They will blame the day when you plan to have them. So it's not good. It's better for parents to first go for screening before starting to have affairs. Yes.
Okay. So that is what the doctor is saying about that matter. Now we are going into, before they display the picture, you're telling us some of the symptoms we look at as a patient of sickle cell. What are some of the symptoms or signs you look at and like, hey, this may be a symptom of sickle cell, you need to rush to the hospital?
The first sign is they are anemic. Like anemic, I mean they have a low hemoglobin and low red blood cells. So anemia, they have anemia. Actually, sickle cell disease is the one of the disease which produces sickle cell which produces anemia.
Anemia.
That anemia which is inherited. So anemia of sickle cell disease is very, very dangerous thing. It's one which causes death among the sickle cell, among the sicklers. Another sign maybe which I could talk about is they are having some, when they are still young, they are having a big spleen. Their abdomen are extended because the spleen, they are having hypersplenomegaly. However, later in life, this spleen undergo auto degeneration and then autosplenectomy, and then this spleen shrinks. Like when the spleen shrinks, mean that these patients or these children won't be having a proper immune system to fight infections. That's why these sicklers are prone to infection. They are having frequent infections. So they normally present with frequent infections. Okay. Yes. Another thing is that they're having vision problems. They cannot see very well because once those, which we shall say that those sickle-shaped cells, when they get stuck into the blood vessels which supply the retina, yes, they cause problem with the vision.
Problem with vision.
Yes, okay. They have a delayed growth. They cannot go very well. They cannot go with like the same like other normal kids. Another thing is they have they get what we call dactylitis. Dactylitis, I mean swelling of the hands and the feet. And those swellings are too painful.
They're too painful.
Yes. Another symptom is painful episodes. They have episodes of pain. They can present with pain in the chest, pain in the abdomen, in the limbs, all over the body. Yes.
Wow, that is interesting. Because now it's so sad that it happens, but still it's good to, if you realize some of these symptoms earlier. Well, we are going into a short commercial break. You're still on Health Clinic. We are on Youth Media. Youth Media, you just go on Facebook or YouTube. You just type in Youth Media, you'll find us, and you'll, even in case you missed the previous shows, you can just always play back, and when you subscribe, you get the notification. See you from the break.
Butis Media Academy esangibwa masanafu okuliranira Pechip Hardware ejjukiza abazadde mwenna okuwandiika abayizi agala okubanguka amasomo gano wammanga kwatandise radio and television presentation, graphic designing, VMX and transmitter controlling, okukyusa ebifaananyi okuva mu studio okudda ku TV, audio and video editing, news anchoring, filming and photography, computer training n'ebirala. Okwewandiisa ku ttendekero lyabwe gendayo nga bukyali Butis Media Academy banjawulo ku matendekero amalala kubanga basomesa practical skills oba hand zone mu masomo gaabwe gonna. Essimu 0753 242 wa 0753 242 awulidde ng'otegeeza omulala. Butis Media Academy esangibwa masanafu okuliranira Pechip Hardware ejjukiza abazadde mwenna okuwandiika abayizi abaagala okubanguka amasomo gano wammanga kwatandise radio and television presentation, graphic designing, VMX and transmitter controlling, okukyusa ebifaananyi okuva mu studio okudda ku TV, audio and video editing, news anchoring, filming and photography, computer training n'ebirala. Okwewandiisa ku ttendekero lyabwe gendayo nga bukyali Butis Media Academy banjawulo ku matendekero amalala kubanga basomesa practical skills oba hand zone mu masomo gaabwe gonna. Essimu 0753 242 wa 0753 242 awulidde ng'otegeeza omulala. Butis Media Academy esangibwa masanafu okuliranira Pechip Hardware ejjukiza abazadde mwenna okuwandiika abayizi abaagala okubanguka amasomo gano wammanga kwatandise radio and television presentation, graphic designing, VMX and transmitter controlling, okukyusa ebifaananyi okuva mu studio okudda ku TV, audio and video editing, news anchoring, filming and photography, computer training n'ebirala. Okwewandiisa ku ttendekero lyabwe gendayo nga bukyali Butis Media Academy banjawulo ku matendekero amalala kubanga basomesa practical skills oba hand zone mu masomo gaabwe gonna. Essimu 0753 242 wa 0753 242 awulidde ng'otegeeza omulala. Butis Media Academy esangibwa masanafu okuliranira Pechip Hardware ejjukiza abazadde mwenna okuwandiika abayizi abaagala okubanguka amasomo gano wammanga kwatandise radio and television presentation, graphic designing, VMX and transmitter controlling, okukyusa ebifaananyi okuva mu studio okudda ku TV, audio and video editing, news anchoring, filming and photography, computer training n'ebirala. Okwewandiisa ku ttendekero lyabwe gendayo nga bukyali Butis Media Academy banjawulo ku matendekero amalala kubanga basomesa practical skills oba hand zone mu masomo gaabwe gonna. Essimu 0753 242 wa 0753 242 awulidde ng'otegeeza omulala. Butis Media Academy esangibwa masanafu okuliranira Pechip Hardware ejjukiza abazadde mwenna okuwandiika abayizi abaagala okubanguka amasomo gano wammanga kwatandise radio and television presentation, graphic designing, VMX
with me, Doctor. Joined in with Dr. Marlene Nicola, right from Molago Hospital. He always gives in his time, the little time he has, the little time he has gotten, he comes here on the show, at least to educate the nation, to teach them and to let them know what it comes when it comes to matters of health. Yeah, we started way back with him. Well, last week we were talking about heart diseases, yeah, and yeah, it was an interesting topic. We saw the questions. He said he'll respond to them because he also wants to give the questions enough time for everybody, and even anybody who has more questions, just keep on. And even on the same topic today, we are talking about sickle cell. In case you have any questions, just go into the comment section and you share out your comment. We shall all tell the doctor and he can always discuss. Well, don't forget, Health Clinic is brought to you by the Fundamental Rights and Protection, whose rights matter and that protect them for you. You can always get us live here exactly 11 a.m. on Friday. We're here in studio with our doctor. And today, before even we went into the break, he was still just telling us how can you avoid sickle cell. What are some of those things you see that, hey, this may be suspicious. But now, doctor, before you look at it, even the symptoms, those sickle cell, is it Does it only get adults or even children get prone to sickle cell?
It starts from childhood.
Childhood.
Yes.
Oh yeah, but now, well, maybe the right question is, when do you realize that you have sickle cell?
Right away from childhood.
So that means child immediately after childhood the symptoms surface.
Not really, but below 6 months you can't see symptoms because we shall see that with the newborn they have their hemoglobin, fetal hemoglobin's high concentration.
Okay.
So you cannot get, actually fetal hemoglobin is trying to antagonize the other hemoglobin if it is there.
Okay.
So the child won't have symptoms when a newborn won't have symptoms. However, when it's growing, like 1 year, you start realizing that when that fetal hemoglobin start decreasing, so the symptoms start to come.
Okay, the symptoms start to come.
Yes.
And when you look at the symptoms starting to come, are there chances that somebody maybe either, because you said below six months, it's hard to identify sickle cell in the child. Are there chances that somebody or a child may take longer without these symptoms surfacing?
Yes.
It's possible.
It is possible. Actually, there may be a sickle. There is what we call, there are factors which can precipitate someone to have a worst, or maybe to have a crisis. Because with the sicklers, once there are people who are like, I'll talk about factors which can really prevent someone from getting what?
Sickle cell.
Like not getting, you are having sickle cell, but from getting a crisis.
A crisis.
A crisis, yes.
What is a crisis now?
With the sickle cell, we're having like 3 to 4 types of crisis. We're having vaso-occlusive crisis. We're having a plastic crisis. We're having Immolytic crisis, and we're having sequestration crisis. I'm going to explain. So with the vaso-occlusive crisis, these sickle-shaped cells, because they are abnormal, they are having properties which enable them to be sticky and rigid. So this causes them to block the small blood vessels which supply blood to different organs. So at the end, the organs which are not supplied by the blood, they undergo ischemia and then infarction. So they will be in pain. So vaso-occlusive crisis is one of the major clinical presentation of sicklers. Because the sickle-shaped cells have blocked the blood vessels which supply the different organs. So this patient will be in pain.
They will be in pain.
Yes. Another crisis is the hemolytic crisis. There is increased breakdown of the sickle-shaped cells. Because with the sickle-shaped cells, the abnormal cells, the abnormal red blood cells, they have a lifespan of 120 days. With the sickle-shaped cells, their lifespan is between 10 to 20 days.
10
so
to 20 days.
They die at annale stage. So this patient will be anemic, because now these blood cells are being broken down by the spleen at annale age, 10 to 20 days. The lifespan is short. However, with the normal lifespan, which is 120 days, is quite long.
It's quite long.
Yes. So a crisis is like the worst, like, I don't know, like something which is, it's a worst form, like it's a worst presentation.
Oh, okay.
Yes.
It's the worst. Are they also, is it like some kind of stages?
And not really.
They're not really.
Yes.
Okay then. Anyway, yeah, that is at least clear. But we didn't know even it's in crisis.
Yes.
Well, that yet at least you cannot get that apart from health.
Actually, you can have a presentation. You can have a vaso-occlusive crisis presentation. You can have a hemolytic crisis presentation. Like we have. You see someone is their eyes they are deep yellow. Like they're having jaundice, meaning that they don't have blood. Their blood cells have undergone hemolysis. So with the moment you present with that, for us we will give you a diagnosis that maybe you are having a hemolytic because we know that you were sickler. Yes. So it's like the worst presentation, clinical presentation.
It's the worst clinical presentation.
Yes.
Well, that is what the doctor is saying. Now, before even we go into the break and we are talking about now the crisis, well, sickle cell is a lot, it has a lot of content, but now we are also still telling us the symptoms or the signs. Were they over?
Yes, maybe I wanted to talk about the factors which can precipitate someone who is already having sickle cell to have a worst presentation. There's stress factors like relating to stress, things concerning with stress. If you're having infections, if a sickler gets malaria, gets a cough, this cough can precipitate him or her to having a crisis. Yes, if a sickler is dehydrated, that's why we encourage these sicklers to keep on rehydrating. If a sickler is dehydrated, yes, this dehydration can predispose him to having a worst presentation. Alcohol. Yes, extreme exercise. Yeah, exercise, and then I talked about stress. Then I talked about infections, exercise, and then dehydration. And then going to places where there is low oxygen tension, like especially at the mountain, hilly places. Yeah, those places have low oxygen tension. You have problem from there.
Oh,
yes.
Okay. So basically, you need to avoid those places.
Yes.
Wow, that is interesting.
And even moving higher, like maybe you are traveling in the airplane. It's not also good for sicklers.
It's not good
because the higher you go, the oxygen tension decrease. Yes.
Okay. Well, I was going to ask you something, but maybe I'll bring it up later on because it's far from this, but it's in the line of health. Well, our viewers, they're displaying something for you, but still they are still telling you, our doctor is still telling you some of those symptoms.
Yes,
or the factors.
actually you can see, they can see there's now a nice picture that we have with the normal red blood cells, which are nicely round and biconcave, and there are those sickle-shaped abnormal cells.
They're like moons, indeed.
Yes, they're like moons. So those ones, they're having a characteristic, they are sticky and then they are ridged. These normal ones, they are a bit flexible and they can move through the small blood vessels. With these ones, the abnormal ones, they get sticky and then they cause problems.
They get sick and cause problems.
Yes, they impair blood saturation. If it happens in the head and they stick in the blood vessels in the head, you get a stroke. That's why sicklers they get strokes. Yes, if it happens in the heart and they block the blood vessels which supply the heart, you get a coronary artery disease. Yes, you get myocardial infarctions. If they happen in the spleen, the kidney, they damage those organs. So at the end, sickle cell is it has a lot of complications. Yes, we shall look at them later, but yes, that picture is really nice.
Wow, that it brings it out. It explains well how sickle cell is.
Yes.
Now we are looking at sickle cell is the topic of discussion, and it's because it's a broad disease that is happening, and people need to know about it. Well, doctor, we are going on to some of the treatment measures and also some of the prevention measures. I believe we can also summarize that because our time is leaving.
With the treatment, we don't have a specific treatment. It depends on how you are presented to the hospital.
Okay.
For those who are in pain, they are having infections, we normally give them antibiotics. We give them pain medication. We give them morphine. For those who are having chest infections, they cannot breathe well, we give them oxygen to support the oxygen saturation, especially if it is low. Actually, treatment is basically supportive.
Treatment is basically supportive.
Yeah, we don't have a definitive treatment, but it just depends on how you present.
Wow.
If they present if those who are anemic, they don't have blood, we give them blood transfusion. Yes. Also we give them medication which can help them to synthesize a lot of red blood cells. We give them folic supplement. We don't give them iron.
Okay.
Actually, for sicklers, don't go to the pharmacies and drug shops to buy iron medication like iron sulfate. Yes, we don't give them iron.
You don't?
Yes. We give them malaria prophylaxis, we give them Fancida, because these sicklers are prone to malaria. Yeah, yesterday we saw that for the sickle cell trait, the carriers, for them they are not affected by malaria.
They are not affected.
Yes. But the sicklers, malaria can kill them.
Malaria can kill
Yes,
them.
that's why we give them malaria prophylaxis. We give them Fancida to take. I talked about antibiotics and pain medication plus blood transfusion.
Okay, now from what you're saying, it's like it's uncurable.
Okay, there are some therapies which are there, but however they are risky, like the stem cell transplant. It is actually it is the only way how you can get cured of sickle cell, but it is not normally done. It's not usually done because it is risky. The chances of you dying from stem cell transplant, they are high.
How is it? How briefly, if you are to explain in our own understanding, not the doctor's understanding with the scientific. How
with the stem cell transplant or bone marrow transplant, we get stem cells from the donor who is normal. Maybe it can be a relative. So we transfuse, we give you those stem cells into your circulation, so that those stem cells, those cells you have given you, they are normal. So they will lead you to be producing normal red blood cells. No, the abnormal ones.
So the cells be in the blood.
Yeah, actually, we first remove what you have into the abnormal cells. Then we transfuse you with the.
In other words, you drain me out.
Yes.
Completely, and wow.
It's really it's an interesting thing, but it is.
Do you have survivors there?
Yes, in
on a scale of countries. In a scale of 100.
Some survive, but it is normally done in developed countries, not here.
But if you are to do a scale of 100, how is it?
Majority won't make it.
Majority won't make it.
Make it, yes.
Well, anyway, now for the issue of sickle cell, as you're talking, it says there are those who won't take that risk, and I believe you, as you said, it's only in developed countries. But now, as you look at sickle cell, how long does the patient with sickle cell live? What is their lifespan?
They are bad myth. They are wrong myth that they die at an early age, but
yeah, that's what it is.
Yes, but majority make it. They die at median age around 42 to 48.
Okay.
Yes.
So it's miraculous if somebody exceeds that, yes.
No, not really, but up to adult.
Those if somebody dies at
25, 10.
You won't live longer.
Yes, it just depends on because there are people who
and throughout that time you're still suffering these symptoms.
Yes, you suffer symptoms, but mild symptoms. Actually, people who stay longer, they suffer mild symptoms.
What do you mean mild? Like simply?
Like they don't get these worst. They don't get these worst symptoms. They are not anemic. Or they don't get severe anemia. They're just like there. They don't get severe pain. They don't get stroke.
So those ones normally come when you're still at a tender age.
Not really, but there are people who get mild symptoms, and there are people who get severe.
Okay,
those with severe symptoms die at an early age.
Wow. Okay.
Yes.
Well, that is clear now, at least. Well, we are still summarizing. You're talking about sickle cell. If you just join it here, I would say you're a little bit late. Actually, not until you are late because you're winding up. Our doctor now is going into some of those prevention measures, or we can look at to avoid, or what we can do in case maybe we are faced with this situation. So, what are some of those?
The best way to prevent sickle cell is to go for screening before you plan to have a child.
Before you plan to have a child.
Yes, that's the best way. That's actually the only way you can prevent sickle cell.
But now we have a problem here where not every child we have is planned.
That's yes.
So you can imagine that those people who have children who are not planned, all the applaud, the lady just calls and they tell you, yeah, I'm pregnant, and you're like, hey.
And you have nothing to do.
But they're lucky because it's in a few cases where you see sickle cells
Yes, sometimes because it is a risk. The risk of getting when you are carrier, they could say 25%. Risk of producing a normal 25%. Still, if you are both carriers, risk of producing a carrier. 50%. So chances are high that you produce carriers. Also chances are still low that you have a sickle cell sickle cell child. So it's not the end that if you are both carriers and you're having the wife is already pregnant. Cannot advise you to abort because you never know that child may be a normal child. Yes.
Okay, that is interesting. Well, the doctor was talking about sickle cell. Sickle cell was the topic of discussion today. Well, Dr. Male, do you have any last remarks for our viewers out there?
Yes, maybe I will give them my contact.
Okay.
For those who have questions, you can reach me on my WhatsApp contact. That is 0753 772 808.
Wow. Repeat that again.
0753 772 808.
Wow. Thank you very much for your time. Hope to see you next time. We're joining us on Health Clinic exactly 11 a.m. on Fridays. That's when you have our doctor's video. And we told the Health Clinic we talk about matters of health. It can be anything that you do want us to discuss about. You don't understand the situation, the symptoms you're suffering from. Just text us. We shall bring in the doctor to explain, to align them well. Well, today we talked about sickle cell patients. For those who missed the show, you can always play back. Don't forget that Health Clinic is brought to you by the Fundamental Rights and Protection, who say rights matter and are there to protect them. For it has been enough show. Brenda bringing you the show Health Clinic. See you next time.
Butis Media Academy esangibwa masanafu okuliranira Pechip Hardware ejjukiza abazadde mwenna okuwandiika abayizi abaagala okubanguka amasomo gano wammanga kwatandise radio and television presentation, graphic designing, VMX and transmitter controlling, okukyusa ebifaananyi okuva mu studio okudda ku TV, audio and video editing, news anchoring, filming and photography, computer training n'ebirala. Okwewandiisa ku ttendekero lyabwe gendayo nga bukyali. Butis Media Academy banjawulo ku matendekero amalala kubanga basomesa practical skills oba hand zone mu masomo gaabwe gonna. Essimu 0753 242 wa 0753 242 awulidde ng'otegeeza omulala. Butis Media Academy esangibwa masanafu okuliranira Pechip Hardware ejjukiza abazadde mwenna okuwandiika abayizi abaagala okubanguka amasomo gano wammanga kwatandise radio and television presentation, graphic designing, VMX and transmitter controlling, okukyusa ebifaananyi okuva mu studio okudda ku TV, audio and video editing, news anchoring,